Hello, everybody. We're at 1 minute past now, so
Hello.
Can everybody hear me and see me? Yeah,
Yes,
we can.
Perfect.
Brilliant. Oh, welcome to today's webinar. We're just letting different people in. Is my colleagues, are you able to let people in as well?
Yeah.
Yeah, brilliant. Okay, if you could
we'll do.
crack on with that. So Claire, do you want to pop the slides up and we can get going?
I am sharing. Can you not see it?
Oh, I can't see it. Yes, I can see that now. Can
you
everybody
see?
see?
I can. Yeah.
Lovely.
Yes, we can see it.
Brilliant. Okay, so we technology's worked. All right. So I'm Nichola Verstraelen. I'm sort of the lead for our community of practice around developing a research culture in the NHS and health and care. And this is our steering group. I'm not going to introduce everybody because there's a lot of us. It's a growing team, but we're here to help support clinical and care leaders on developing that research culture. So our webinar today is on ward accreditation and enabling a research culture as part of that ward accreditation. So you're in the right room if that's what you've come for today. So welcome. So just next slide, please, Claire. So here are our speakers that are speaking today. So I'm going to let everybody else introduce themselves as well, but we're going to talking about how that ward accreditation can help you improve that research culture. So that's what our research culture tree is in the corner as well. Just move on to the next slide for me. Oh dear. If somebody could mute themselves. I've managed to mute that. Okay, so just a reminder of where we've come from. So we developed the Matrons and Health and Care Leaders Research Toolkit, which is a publication which is on an NHS England, on the NHS England website, and we've got a number of different things that can also help support us with this growing a research culture. One of these is our Futures NHS webpage, which is just, there's a screenshot here of the sorts of categories that we have within that Futures NHS webpage. And when we're talking today about research culture, we're talking about that whole spectrum of research, from evidence-based practice to developing your own research and delivering other people's research as well. So bear that in mind. It is about the whole spectrum of research. And don't forget to go on to this Futures webpage because there's loads and loads of things on there. There is a QR code that you can scan, and we've got lots of different other things as well, but there's loads of information for you to read up on this. Next slide, please. So I'm going to hand over to Nikki, who is going to just quickly introduce herself and tell us a little bit about the background around ward accreditation in general. Nikki, are you there?
I'm here, thank you, Nichola. So good afternoon, everyone. I'm Nikki Sarrkar. I'm Clinical Lead for Quality, Innovation and Transformation here at Nottingham University Hospitals. I have led on our ward accreditation programme, also known as local accreditation. We've termed it as Accrediting Care Excellence, also known as ACE, here in Nottingham, and that's because we wanted to be all-encompassing of, all wards and departments. So a brief overview of ward accreditation. In essence, it's an overarching framework of a set of standards that wards and departments are assessed against to produce a accreditation outcome. And this has been developing for over a decade across different organisations. So Scoping found that Salford were one of the early pioneers for developing this, and then other organisations becoming early adopters. In 2019, Ruth May, Chief Nursing Officer at the time, recommended that organisations have a ward accreditation programme as part of the collective leadership approach. So that's shared decision making, nursing and midwifery excellence, and ward accreditation. And this led to a guide being developed for how to implement ward accreditation. So I think it's worth mentioning that as this is a guide, there are no standardised tools or templates for this. And organisations have therefore developed their own tools, and as is in this case in Nottingham, which I'll talk about later in the presentation.
Brilliant, thanks for that great introduction. Next slide, Claire. So as I was researching a little bit about this myself, many of you will know, but there is an exemplar sort of template on the NHS England website about award accreditation. And I've popped the link in this, which we can send out to people afterwards, so that you can link into that. But in essence, a number of the domains are linking into the CQC domain under all the different sections, but in terms of what we are interested in, the well-led section, because research is part of that. And as part of this template that you can see on the screen, the top bits are the part of the exemplar, and I've added in the bottom here an example of something around research, and that is what we would love to see across the whole of the country, adding that research question into your award accreditations. And brilliantly today we are going to be hearing from people of how they have done that and what the examples are of that in practice. So next slide, please. So Kath, are you on the call? I think I saw you come in.
I am, yes. Hi, Nicola. Hi, everybody.
Hiya, Kath. So Kath is going to present today what we did at Lancashire Teaching, and this was around when I was an NHR 70/70 nurse, which is now the current SRL leaders. I was looking at this in our trust, and Kath was my brilliant colleague, who's the quality assurance matron that helped us bring this into the award accreditation scheme in our trust. So Kath's going to talk about that. So Kath, do you want to introduce yourself and then go through your slides and just say next slide as you go along? Thanks, Kath.
Yeah, thanks, Nicola, and hi everybody. So I'm Kathryn Dickinson. I'm the quality assurance matron at Lancashire Teaching Hospitals. And I'm here to talk to you about our STAR, as we call it, Quality Assurance Framework, and how we've incorporated research into that. So next slide, thank you. So just a little bit about us, if you're already explaining and introduce, we all kind of follow Salford's model with our quality assurance frameworks, and I do network with quite a lot of colleagues around the trust, and we all have similar versions of the same thing, but we're all very different organisations apply our quality assurance frameworks, our award accreditation frameworks in different ways. So a little bit about us. We've been going since 2017. So 8 years in now, just actually 8 years this month. I've been in it since the start of it as one of the team facilitating this, and now matron with the team. We cover all clinical areas, and within our region we're quite unusual with that. We're an acute trust, so we don't have community, but we do all clinical areas, including all specialities, women, children's, medicine, surgery, our diagnostics, and also including our very own Lancashire Clinical Research Facility. Our accreditation framework has 2 parts to it. So there's monthly reviews, which are performed by the matrons or professional leads each month, and then the STAR visits, which are our deep dives, which is undertaken by the team. We've got different versions of this to try to make it bespoke for the areas rather than a one-size-fits-all, which cover adult inpatient, outpatients, ED, children's inpatient, outpatients, children's ED, neonatal intensive care, maternity theatres and pharmacy. And as you've already explained, we try to follow the CQC guidance, looking at what were the key lines of inquiries, now the single assessment framework, trying to do our own internal CQC inspection, align with how they would look at things. It's an ever-changing framework. It needs to keep changing and being effective, being robust as things do evolve over time. So next slide, thank you. Again, just a little bit about it, just to give you some context. Similar to other trusts from my learning from colleagues around our region, we have different domains. We've got an environmental aspect, staff feedback, patient feedback and documentation, and we also look at it from a 15 steps approach. So from a layperson, relative, visitor coming in, how do I feel? Is it warm, friendly? How confident am I that the person is going to receive good care? So next slide, thank you. So STAR and research, as you said, Nicola, came to me, it doesn't seem like 2 minutes ago, but a few years ago now, I want to say 2019-ish, about how we can then get research into STAR. and you really overwhelmed me with the importance of research. As a registered nurse for many years, obviously I knew a bit, but always keen to learn more. And it was, you know, the importance of how research is aligned to well-performing organisations. We know there's better outcomes for patients. But as with anything, with our accreditation frameworks, it's how we assess it. So we always had to understand around what is actually happening at the moment, what is the right thing to measure, how to measure it. And there's obviously that there's a skill there that comes with that about measuring the right thing. Because often people will come and they know that the STAR framework in our trust actually staff really take on board. They really, the majority absolutely run with it. They want to get all the questions right. They want to meet all the standards. They want to do well in the STAR, so that we know by getting something in the STAR will drive improvement, drive awareness, drive high standards. But actually it's, well, what's the right measure for this? What would be the good thing? So the very first thing we did, and after lots of discussion, wasn't it, Nicola, was around actually a research board, having a research board in the area, or something on our performance boards, which all the wards and departments have, dedicated to research, that has research contacts, something that's happening about research ideally, but also the research champion for that area. This was very much at the early days. Not all the wards had the boards at the time, not everywhere had a champion, but by putting it into STAR and saying that this is an expected standard really drove performance and awareness of this. So that's in actually the monthlies and the visits. And then once it was rolled out across the trust, it pretty much happened. So there were this involved close linking in with the research team and the research leads to say, where are we with the board rollout, where are we with the champions, what's expected of the champions. And then as we went onto the wards and departments, we assessed it. It was a yes or a no. And then once it was rolled out and embedded, it pretty much was a sustained yes. So next slide, please. This just demonstrates our performance. So pretty much once it was all out there, it was sustained. And this is just one slide showing the latest year, but actually from day one, it was always performing well. So that's really good. So much so, we've actually taken it out this year. So we do periodic reviews of our STAR frameworks. And once everybody had got that question, because the boards are there, the boards are still there. We've actually taken it out for a while, but we're always reviewing it. So it is still in the monthlies, but we've taken it out because it's just in line with it performing really well. So next slide, please. So what we are doing though, because we understand and we want to promote research, we want to emphasise the importance of it around, and I think to be fair, it would be fair and honest to say there's still a lot of work to do. Everybody's safety standards and priorities keep shifting, and we really want to drive the importance of research. So we actually have developed a new gold star approval process. So once people get a series of stars in a row, if they get 3 silver stars in a row, they would then proceed onto a gold star. And there's an approval panel process for this. And part of that would be to say, what's your involvement in research? Because we want the clinical area to demonstrate what are they involved in, what's the impact, what's the journey, what are staff aware. And as you can appreciate, for 118 areas, that'll be very different. So very different from a medical ward to a surgical ward, to a children's, to a diagnostic area. So the next slide, please. I've just got a little example here, and our pharmacy team are very fine to share this. They've just recently gone through our gold approval panel. So our pharmacy teams in Preston and Chorley have presented this in April, May, and they've shared this to say what they're doing. So an awful lot of work is going on there. But similarly, from some of the ward departments who've gone through, they've also put different perspectives on this. So everybody is, although research at times can feel a bit of an aspirational standard, as you can see from this with what the pharmacy have put in, they're really absolutely all over it. The trainees are included in it. It's just embedded, and they're always, our pharmacy are on a very much a developmental journey. So next slide, please. So really, what's next? So again, reviewing and linking in with our senior leads of the research team, just to say, where are we now with champions and linked nurses? What's to be expected? Are they still out there? Do old areas have them? What are we looking for? Just to keep the emphasis out there, really. Research is in our gold approvals criteria now. So for the future, moving on, everybody will know that this is one of the things that they have to really if they aren't there yet, they need to really demonstrate that they are meeting this standard. Our trust is also doing self-assessment around their research capabilities, linking in with our leads. That's a work in progress. So we're expecting some actions to maybe come out of that to make sure that everybody's ready for research. And as always, like all accreditation frameworks, we just constantly keep evolving it and making sure we're aligned with the CQC and we're looking at all the right things that we need to be looking at. And obviously linking in closely with the research team and leads. And that's where we are up to now. So still in there, still ongoing, and hopeful for things to develop further in the future. Hope that's okay, and happy for any questions, unless you want those at the end, Nicola.
Thanks, Kathryn. Yeah, that's absolutely brilliant. There are a few comments in the chat box, so you could have a look at those maybe if we move on to the next slide, next presenter, so we can run through them. But yeah, I'm just so grateful to you, Kathryn, for allowing that, and obviously with our chief nurse allowing that to happen in the early days of it all. And I think it's yeah obviously we were able to achieve it. COVID, I think, helped in one way to get all of those research champions. I think at the time we had 90 odd. And that has grown, so there are more research champions now as well. It's just thinking about what those questions are, aren't they, that is possible for people to achieve. And so now we're going to be moving on to Suzanne, who probably will be talking about different questions that they have. So it'd be really interesting to hear the different perspectives on that. So thanks, Kathryn. So Suzanne, are you there?
I am. Thank you very much, Nicola. And well, going after Kathy, I have to say we are not as far ahead, and I think we can learn a lot from you. So thank you very much for that. That was really helpful. So my name's Suzanne Bench, and I work at Guy's and St Thomas's NHS Trust as the Director of Nursing and Midwifery for research. So my role is to support and encourage nursing research and engagement across the whole trust for every nurse and midwife, whether they're involved in research delivery or whether they're clinical nurses and midwives who are developing their own projects or supporting research awareness culture more broadly. I'm also work really closely with the research and development department, particularly Claire Harris, who's one of our deputy directors of R&D for workforce, and also Louise and Judith, who are our quality team. And these are the two really important people because these two people lead our ward accreditation programme. So we've put these slides together collectively, but I'm presenting them today because unfortunately the others can't be here. But I definitely can't take any of the credit for this. I think it's worth saying that how did all this start for us? Well, I think it started for me. Like Nicola, I was an NIHR 70 nurse some time ago in that first cohort. And it really made me start to think about how we can embed research into everyday practice and the best way that we can do that. At the time, I was working at a different NHS organisation, and I was lucky enough to be involved in a ward accreditation programme that was just being set up there. And so we worked together there to think about how we can move forward. But today I'm going to talk to you about what we've done at Guy's and St Thomas's. So next slide, please. So just for some context, we are a very large, complex trust consisting of 5 hospital sites across London and a very large community base across the breadth of across the breadth of adult and paediatric cohorts as well. And we're divided into a number of different clinical divisions. This makes things somewhat challenging because everything we do, we need to make sure that we can roll out across every single hospital site, again, across all of our clinical groups, and that everybody feels involved in any programs that we set up. So next slide, please. We're led by a chief nurse called Avi Bhatia, and she's an inspirational chief nurse. And I think one of the things that's absolutely critical in all of this is having that leadership and somebody who's really championing you in your organisation. And Avi was responsible for employing me in January 2022, and really handing over to me and saying, okay, please make this happen. And so I was left with a sort of open agenda, really, in terms of how to do this. And so we developed a team, and we called the team ACORN, which is the Centre of Research for Nurses and Midwives. And collectively, our team have put together lots of different opportunities for nurses and midwives to learn more about research, to do an internship, to have support, to learn about how to improve the culture of research, etc., etc. I won't go through all of this because that's not the purpose. But one of the really challenging things that we faced was how to get this out to the shop floor staff. I'm an intensive care nurse. I work on intensive care half a day a week. And even within my own department, I was finding it difficult to do that, let alone doing it in all of those departments and clinical groups across all of these hospital sites. So we really had to put our heads together. And we are a little bit further behind in terms of our accreditation journey. They tried to set up an accreditation program just prior to COVID, and then that had been put on hold. And so when I came into post, they were just revigorating it and starting again. And so that provided a really timely opportunity to get in right from the beginning of the start of the accreditation program and work with the accreditation team and with the clinical directors of nursing to really think about how this would work most effectively. So next slide, please. Because what we really wanted to do was make sure that everybody could see how we would link research to service provision, because we felt that if we could show people the connections, that would be our way in. We were also really fortunate at this time that we were just in the process of writing a new nursing and midwifery strategy. And as part of the engagement work for that strategy, we were really, really pleased to see, and I think this was partly due to COVID, that research and engagement in research had come through as a really strong theme. So that became a core element of our nursing and midwifery strategy. We were also at that time undergoing some changes with our quality improvement teams, our Nightingale Academy, which is responsible for professional development, as well as the research and development department. So this was an opportunity for all of us to come together and think about how best this would look. So this took quite a lot of conversations and discussion, and also to think about how we might support managers who might want to integrate this into their departments, but had many, many other priorities as well. So our accreditation scheme as it stands is very similar to that which Kathy described. We have two elements, the sort of monthly audits, which are carried out by the teams themselves. And then we have snapshot unannounced visits where a collective team go in and assess an environment on a number of different domains. Next slide, please. And we chose to put research under the leadership domain because, as Kathy said previously, that fits very well with the well-led component of the CQC, which is where it would be assessed from a CQC visit. We had a whole list of things that we wanted to add into this domain. I mean, probably it was at least an A4 sheet of bullet point questions. And it became very clear very quickly that there was no way we were going to be able to put all of these things in, because there were so many other domains, and we wanted this to be a feasible process that people would buy into. And so we spent a long time debating which would be perhaps a really useful starting point in terms of just a couple of key questions that we could start the process off. And we came to a collective decision that these would be the two questions that we would ask. So the first one being, are any nurses and midwives on the ward undertaking any QI projects, research or literature reviews as part of an academic award? Because we thought that was really important, because quite often people are doing these things and nobody really knows about them, and people finish their projects and they might write their dissertations, they don't ever publish them, and they sit on a dusty shelf. So we thought this would really bring to light work that people were doing that could really inform future practice within the ward or department. I should say that at this point, our accreditation program only focuses on the wards. We haven't yet gone out into any of the other areas. The second question that we decided would be quite a key question would be, does the ward have a nurse or midwife allocated to the role of either a research or improvement champion? Because again, we thought that was a real lever in terms of having this. And what we meant by a champion was not a research delivery nurse who was there to promote patient engagement in trials, but a clinical nurse or midwife from the ward who actually would do some of the things that Kathy talked about, organise a research board, be responsible for disseminating any opportunities to the staff on the ward about funding for projects, opportunities to do internships or training around research, in addition to liaising with the ACORN team and with R&D to promote research more broadly. So it was a much broader role. We also decided that we didn't want to focus purely on it as a research champion, because there's such an overlap between research and improvement, and we really wanted the ward staff to see how the links were there. We wanted them to identify where their gaps were, to work together with us on improvement projects, and then to use that to develop into sort of research projects as appropriate. So these are the two questions that we ask, and they are asked by the accreditation team who go in, and this is asked to 3 members of staff on each of the visits, always a more junior member of staff, a band 5 and a more senior member of staff, so we can get a range of ideas of whether people think this is actually happening. And then the results are pulled together in a digital report to the leadership team and shared with the rest of the ward team. And then, as Kathy said, we review these metrics on an annual basis. So next slide, please. So to date, having started this programme at the end of 2022, the team have carried out more than 130 accreditation visits. We've had some challenges. We've had the industrial action. We had a massive cyber attack on our IT systems, which meant that we couldn't do some of these things for a while. So we've had to sort of have breaks and come back. But we've had visits to over 50 adult inpatient wards. And like Kathy described, all of these data go together to give the ward an overall rating of sort of a bronze, silver, gold. So we're currently working towards going live in the maternity areas as well, and then are going to be moving towards the paediatric inpatient wards before rolling it out across the rest of the, as I said, very large organisation that we have. And when we were reviewing this for this presentation, initially we were thinking, do you know, we don't feel like we've got anywhere. It feels like when we go on some of these accreditation visits that the answer's always no. Nobody says that they've got one of these. Nobody has given us positive results. But actually, when we look back on the results that we've had over the months from January 23 to present, we can see that there has been an improvement, and it is a very slow improvement, and we certainly haven't got up to the wonderful 100% that was described earlier, but we are making progress, and I think that is a really important point, that we are making progress. So next slide, please. And, you know, thinking, reflecting on all of this, I think it's more than just about the numbers. I think what this embedding just these two questions into our accreditation visits has enabled is for us to start linking research to areas of importance as seen by the clinical staff and managers, because there may well be other areas from the accreditation process that come out that are areas where they're not performing so well, and this gives us an opportunity to go to the team and work with them and support them to develop research. But also, you know, thinking about that, every contact counts. You know, every person that we talk to on every single visit is that opportunity for us to raise awareness of our team and the importance of research, how people can get involved. And we've seen a growing number of people that are attending the one-to-one clinics that we offer as part of ACORN, and an increasing number of people applying for some of the courses that we run as well. It's also really helped to develop the relationships between our team, the Nightingale Academy, which is responsible for professional development, the workforce team. One of the things that we've done with the workforce team is we've added into their establishment reviews now. They never had a question about establishment in terms of whether anybody had any protected time for research in any way, but we've now added that into the establishment review, so that question is asked, and they're asked to consider that as part of their sort of business planning for the next year. So this is really all tying in together, and we've wrapped that the support around that in terms of developing various guidance documents, such as embedding research conversations into appraisals, our advice clinics, and having group leads for each of our clinical groups that liaise with us. So I think this is a small part of a whole, and all of it is helping us to move forward in a I believe a positive way, albeit slowly. So I think that might be our last slide, but I'll just take it one step further in case I've missed something. No, just to say thank you to you all for listening. And if you did want to get in contact with us at all, then that is our email addressed for the ACORN team. Thank you very much.
Brilliant. Thank you so much, Suzanne. That is really lovely to hear different perspectives from another organisation. And I think ultimately it's not easy to do this, is it? I think we're agreeing it's not. It's certainly not easy, and we're not expecting. I know we got 100% for Lancashire Teaching, but you know that was the very simple start. So I think our thoughts were start simply, and then we'll move to the next level. Of making things a little bit more complex, but yeah, it's great to bring the two clinical and research teams together, because ultimately then we can help to deliver evidence-based care to everybody. You know, part of the CQC and what we should be doing as clinicians, and offering studies and research studies to all of our patients that come through our doors. So brilliant, really great. And I think as I've popped in the chat, I think it'd be good if we could pop a section in our Futures NHS webpage with the questions that we've all the organisations that have got questions on there, so that it can help stimulate others if they can do that in their own organisations too. So thanks so much, Suzanne. Right. Moving on to the next presentation. Unfortunately, Christina can't join us today, very, very sadly. She would do a much better job of this than me, but I'm just going to run through her slides of what she has done at Wrightington, Wigan and Leigh Teaching Hospitals. So next slide, please. So Christina is also a senior research leader, and she's been working with her organisation. She's a consultant nurse and, as I said, a senior research leader. She's a clinical lecturer in Edge Hill University as well. So she's been doing the same sort of things and trying to be working with her ward accreditation team on delivering this side of things. Next slide. Not all trusts have a research strategy, but a lot will now, and obviously this is part of their research strategy, and she's highlighted this section here about nurturing that culture that embeds research as a core component of high quality service delivery and develop a sustainable research active workforce. Yeah, we want it to be standard part of what we do. You know, you might refer to the physio if a patient's got musculoskeletal problem. You know, we want you to be referring to research as a standard of practice. Next slide. So what they are doing is obviously they're creating their ward accreditation program, and they've created a standard operational procedure for that. And so Christina has inputted into that. So the sorts of things that they've been doing is, again, creating research champions. And I know they've got 52 research champions now. They've got the research notice board in the areas. And they're promoting that engaging with the clinical research delivery team as opposed to us working in silo and separately. So, you know, are there opportunities for your ward staff to be shadowing the research delivery team and sort of understanding what that research delivery role is, so that then when a patient asks you whether they can take part in any studies, or actually you identify that they might be suitable for a study, you really understand what that means. And so that might be something that we could look at if we were helping to support people with this side of things. Shadow, you learn so much. And a very important thing that she's added onto here is adding the research to those ward team meeting agendas. Often in research we get put to the bottom of the agenda. I'm not crying, but you know, it's great just to have it on agendas, so that people can talk about it. And quite often people are scared of research, but we want those conversations to open up so that we can understand where the clinical teams are coming from, so that we can work together. So that's just another way that they've done that. Next slide. And so they've put theirs into like a point system, which sounds really cool as well. So if you've got a research board and you've got it on your agenda, all of your sort of huddles and your team meetings, 1 point. So promoting recruitment is another point. If you've got staff that have got certificates that are attending research training, whether it can just be GCP, good clinical practice, or going into more detail about doing a literature search on a care pathway so that you could inform that evidence-based practice. Another point. Shadowing the team, you get a point. We like a good point system. It's a bit like our STAR system, but in a different sort of way. And other things there. So I will be sending these slides out as well so that everybody can see the sorts of things that they might be able to pick up in their area, in their trust. Next slide. And these are the things that her team have developed to help support that as well, because it's all right saying, do this, but you might need a bit of background reading or things that can help guide you and direct you, because thinking about when you go out onto the inspections and are visiting those clinical areas. I know when we did ours, Kathryn, I had to give the sort of answers to what those questions might be as well, as opposed to just saying what the question might be, so that the people that aren't involved in the research side can understand what the sorts of things that they're looking for. So this sort of thing, really helps with that. So they develop posters, leaflets and that sort of thing. Next slide. Yeah, and that's them saying that they've got 52 research champions in their organisation so far, which it started from that stimulating the conversation on ward accreditation. Next slide. So they haven't started to implement that yet, but we will hopefully hear from Christina in the future. we'll be briefly touching on our next webinar, so hopefully Christina can come back for that one. So that was just a very quick run through at Wrightington and Wigan, because I'm not Christina, but I wanted to highlight some of the questions and things that they've worked on around in her organisation. So moving on in the geography, I'm not great with geography, north, south, east, west, Nottingham. We're going to invite Helen and Nikki to talk about how they've done it in their organisation. So welcome, Helen and Nikki.
Thank you, and thank you for having us and asking us to come and talk about this topic. So my name's Helen Janiszewski. I'm a midwife. I'm the clinical lead for nursing and midwifery research and innovation at Nottingham University Hospitals, and I'm also a senior research leader.
Hello, and again, Nikki Sarrkar as introductions earlier. So I guess an overview of our accreditation ACE came about at NUH is, so as we touched on earlier, when we embarked on this journey, this was in 2023, so a bit like Suzanne, really, you know, we're in early stages of our accreditation journey, but we discovered that there was no standardised tool from NHS England that we could, you know, to pick up and implement. And in lots of ways that would have been really useful and really handy to have had, you know, in terms of utilising validated tools and all of those benchmarking capabilities that come with that. However, it did enable us, as other organisations, enable us to develop a tool that we feel was reflective of where we were as an organisation. So we've taken our learning from successful designations at Nottingham, such as Magna and Pathway to Excellence, as part of the Care Excellence journey we've been on. And we did do loads of scoping around this, and we certainly did look at the STAR framework. So thank you for that, Christine. Next slide, please. And I think it's worth mentioning as well that we have worked really hard to try and make this tool as outcome focused as possible. So we have got a number of process measures in there, but we have been tried to be very outcome focused. So the ACE tool is built around these 4 domains, and within the domains are standards within these. So domain 1 is our safety and clinical effectiveness domain, which very much looks at our metrics, nursing midwifery audits, our harms, etc. Domain 2 is improvement, research and innovation, which I will draw your attention to. Domain 3 is our patient experience, so that relationship-centred care. What is it like to be a patient, you know, in our care? And domain 4 is our people experience, so it's very much about our people, our workforce. So all the domains, they work or have been co-developed with our subject expert leads here at Nottingham, and domain 2 was developed with our key subject expert in this field, which is Helen. And also, I think it's again worth that we were very research focused from the beginning. I think because we have such as Helen in this role and work very collaboratively and closely with Helen. And also that my boss, my line manager, is Dr. Louise Bramley, who's Assistant Director of Nursing and also Clinical Director for Research and Innovation. So in some ways there was no hiding from it as well. Next slide, please, and over to you, Helen.
Brilliant, thank you. So just going back a little bit, so we developed a research maturity matrix, which was really to help around the implementation of our nursing and midwifery strategy, in particular the research and innovation section. And what we found is when we started to put the standards together around ACE for the research domain, that this became a really useful tool because we'd already identified what some of the outcome measures could be. We'd already looked at what different elements led to sort of progress plans, substantial progress and established. And this is a tool that we also use to help support completion of the SORT tool. So it was really helpful in bringing everything together. And we found that this is a really helpful document to give to ward leaders when we start to talk about ward accreditation, and that, you know, we're going to be looking at the research domain. This is a really kind of useful implementation tool, but also a bit of a benchmark as well to look at, you know, what's going well, how do we move to the next stage, and what's some of those, you know, real key outcome measures that we're going to be looking at. Next slide, please. So in terms of domain 2, so domain 2, as Nikki said already, is around improvement, innovation and research. So what we're specifically talking about today is the 2 questions that we ask around innovation and research, but there are other questions that are around improvement. But we were, after much consideration, we felt it was important to ask them as 2 very separate questions to really draw out that information that we needed around research. So as Nikki's already mentioned, these were put together with subject leads. So we had the head of nursing for research and innovation, who really came from a research delivery perspective. I was involved, as Nikki's mentioned, Dr. Louise Bramley was involved. So we felt we'd got a really well-rounded approach to looking at how these questions were developed. So I think similarly to what's been described before, we were looking around that, how are staff using research evidence? How are we getting assurance that actually practice is underpinned through that the evidence is being used, that people know about research? But we ask specifically whether there are examples of how staff are using research. So, are we utilising some of the programmes and the existing infrastructure we've got around research and innovation? So examples are sort of Chief Nurse Fellow programmes, if people are doing degree or master's dissertations, what's driving those forward, and also how are we starting to implement some of the findings? So we then have come up with suggestions about what would be not accredited, accredited, good and excellent, depending really on what examples and what evidence is then shared with us. I think this is also really helpful how it ties in with the maturity matrix, because it gives examples of if you are accredited, how do you move on to being good? How do you move on to being excellent? What are those additional things that are needed? Next slide, please. So the next question was really around that, how we develop that research active environment. We know that organisations that are research active have better outcomes. And so how do we ensure that staff know about the research that's being undertaken in the area? So we do recognise that sometimes there isn't clinical research that is being undertaken, and then we start to draw out, about what staff awareness of research, how would they signpost. And again, as somebody had mentioned before, this is really about making sure that all patients and families that come through our hospital have the opportunity to be involved in research if they want to be involved. Next slide, please.
Thanks, Helen. So we're coming to close the first sort of circuit of inpatient areas. So we've got over 96 inpatient areas here, and we're close to 90 inpatient areas, and we've commenced pilots in non-inpatient areas, so such as therapies and outpatients. So what we have here, this is a piece of work that's it's in its infancy, but this is the intelligence that we are collating, which has created this dashboard. And what we found is that, however, from the scoring of the standards, this tool gives us an idea of how certain programmes of work are really being utilised and understood by teams at ward and department level. So this is a screenshot of the dashboard, which I've sort of filtered down, but where you can see 2.3 and 2.4, which Helen just talked about, and that's the evidence-based and the research standard. You can see how this is performing against the other standards in the tool. So the formula's worked out, it's been worked out with the analysts, and it's worked out by the number of areas scoring excellent and good in these standards. And what we've been able to see is in that these 2 standards are ranking low compared to the other standards. So if you see there, such as preceptorship, for example, that is scoring really well. So it does suggest there is a translational gap here that's been really useful to identify. And this correlates with what we're seeing when we come to these standards as part of the ACE visit. When we do ask the question around how they utilise the evidence base, for example, if I'm being very honest and transparent, it falls flat, and we really have to change our language and tease out from the teams the local activity for these standards. For the research and evidence-based standards, they aren't always making the connections, so the teams out there aren't always making the connection that they are utilising the evidence base to inform practice. And also for the research standard, where we're looking at the research sort of partnership, so the teams within the clinical areas and the partnership with the clinical teams, there is often a real disconnect how they're interacting with each other. what we find is that there's little communication and understanding between the two roles, who function without really demonstrating any interdependency. So, I mean, I think that is fair to say, and I don't know if Helen wants to add anything with that. That sort of informed us where we really do need to do some more work and think about the language as well, when we're talking about research. Next slide.
Thank you. So yeah, so I think that leads really nicely on to the next steps, really. I think that, so we pulled together a group of experts to look at the questions and what questions should we be asking. And I do wonder whether, because we are so ingrained in research, actually that's why when we've taken the questions out to the clinical areas, perhaps they haven't translated in the way that we thought they might. So drawing on the experiences that we've had, we're now looking at the next iteration of questions around the research and innovation domain to really understand, you know, how do we draw the information out that we're seeking to get, and really engaging with the clinical teams around, you know, what does research mean to you? What's innovation? How did the two go together? So we are doing some work as well with our teams around the, you know, the Matrons Toolkit for research, and really starting to kind of drive those questions forward. I think, as Nikki identified as well, we have also identified that there perhaps is some work to do. We have, you know, there's quite a large infrastructure around innovation and research training and opportunities, and looking at how they then translate into practice. So I think, you know, within healthcare, we are very innovative, you know, particularly when working on the wards, but it's around that collecting the data before, collecting the data after. How do you know it's made a difference? You know, what outcome measures are we looking at? So I think that is also part of the next steps, is really looking at how we support our clinical teams with that element of it. And again, really driving forward that research active environment, you know, pushing that message that research is everybody's business. As Nichola had said, you know, at the very beginning, there is a huge spectrum around research, you know, from being research curious right up until being, you know, independently research active. And it is making sure that, you know, research is seen as everybody's business, and making sure that, you know, patients and families have that opportunity to be involved. Thank you. I think questions were next, but we may do those at the end. Oh, sorry, Nikki, last slide.
No, that's okay. Yeah. So I set up the chair the Ward and Local Accreditation subgroup for Nurse and Midwifery Excellence UK. So NAME's an independent group made up of nurses and midwives from down the country, and this subgroup feeds into the overarching NAME UK. So we've been going for 2 years now, and we've got a growing membership of over 100 members for this subgroup. That's accreditation and quality leads, and this has been really invaluable to bring challenges to this group to explore and seek advice and hearing those lived experience from other leads. And it's, you know, it is, as is this community of practice, an excellent way to build connections. And this how to develop a research standard in our local accreditation tools has been brought to this group a number of times. And it has generated some really, you know, really good discussions. So this is just to open up to you as well, to keep that, you know, keep us connected. If anyone did want to come to this group, to drop in, to ask questions around research, or give some advice to the group as well, you'd be more than welcome. Thank you.
Brilliant. Oh, thank you. That was really, really interesting, and a really analytical deep dive into how you can do this whilst also talking the same language as to quality improvement, which is such a, you know, a big thing in the NHS and health and care, isn't it, at the moment? So we've just got a question on that. Is there a way to find out who's on the NAME UK group? Nikki, do you want to?
Yeah, do you want me to come? Yeah, Alison, we've got. I can connect you with our secretary, who can send you an invite, or also if you want to filter down anyone specifically.
And I was just going to ask, actually, because I was when I was speaking to Kathryn about what we're doing at Lancashire Teaching. Kathryn, are you there? Are you part of this group?
Hi, so no, it's really interesting. I was just going to put something in the chat then. It's really interesting because the value of networking is so important. Ours is my network group, well, it's not mine, the one I'm involved in is started as a Northwest accreditation forum just for sharing, problem solving, mainly within our trust. So it'd be Slanks, Blackpool, Morecambe Bay, but it's open wide. So Liverpool, Manchester, we've got some from Yorkshire, Humberside, and beyond. So I think it'd be really valuable to be involved in that. Thank you. I've just seen, I was just going to put it in the chat. Thanks, Nikki. Yeah, it'd be great because it's that informal sharing that is really, and that peer support is priceless. I think it's really like today, everybody's seeing where everybody's at with different things, getting little bits of information and bits for sharing and light bulb moments and ideas. So no, I'd be keen to be involved, and happily anybody welcome to join our forum as well. If anybody wants anything that I can support with, please feel free to drop me a line as well. So thank you.
That's brilliant. So we're starting a new revolution. After every webinar, we're starting a new revolution, and because I know what it's like. It's some organisations haven't thought about this at all, and so if you can join in with people that have already started thinking about it, that it's so much better, isn't it? So yeah, we will send these slides out so you've got everybody's contact details as well, and yeah, if you want us to, obviously this recording you could use at your meetings and different things and send out to distribution lists, because I don't know, is like everybody in the country on that potential? Have you got like a distribution list for everybody that does ward accreditation in the NHS? That would be handy if we had that, wouldn't it? Because then we can send this out. But as I said, we'll start a section in our futures webpage on the questions that we've got on, the ones that we've talked about, and any others. So, and obviously everywhere is different. So, we're talking mainly about acute trusts here, aren't we? But there's community groups as well, and I don't know if you have a similar sort of accreditation in the community and in mental health and that sort of thing. I think, is Christina Samway on the call? Is she? Do you have anything in mental health? I'm calling you out here if you're still there. Don't know if she's still there. Nikki.
We had our subgroup meeting this week, and there was a colleague there from the community, and I think they're very far and few between. And she's doing a great job, but really wants to build. And and she did talk about improvements, innovation, and research, and how that can be built into the community. A community tool. We haven't got a community tool here yet across Nottinghamshire, but you can absolutely see where this has legs to expand across that.
Absolutely. It just, like it's bespoke for every organisation, it can be bespoke for community as well. Kerry, you got your hand up.
Yeah, it was just an observation really that we've at Sherwood Forest, we've been starting to add research into ward accreditation, and I think numerous people have mentioned the terminology can be quite tricky, and I think we have to get that right, because if you say how is research informed, people might run a mile. Whereas trying to state evidence-based practice and really linking in with the knowledge and library hubs has been really helpful in that, and showing people how they can use these existing services to help them. And just an observation really, we started being on the panel as either clinical academics or research staff last year, and this has led to some ward accreditation projects being pursued to get external funding to develop into more research projects, or it's helped people with career development. So there's been lots of ongoing benefits for us. And it has been a really useful recruiting ground for those, clinical research leaders of the future too. So I think there have been wider benefits as well.
That's brilliant to hear. Yeah, it'd be really good to catch up with you as well. If we can have this section in the futures webpage, and hear more about that for sure. But you're absolutely right. The terminology is the key. Perhaps not using the word research at all. you know, because evidence-based practice is something that we come out of university absolutely believing in. And then, you know, when you ask, because evidence, we've had a webinar in the past about evidence, because, and what we're talking about is research evidence. And, you know, there is other bits of evidence, isn't there, that, you know, your audits can support that, and, you know, data, metrics and different things like that is also evidence in the dictionary, but we're talking about research evidence, you know, high quality evidence, aren't we? So really, really interesting, and we've come to the end, and we're not going to go through these questions, but I've just got the last slide that I can just show you when what our next webinar is about. When it is on the 18th of September, going back to our usual time of 2 till 3, and it's basically following on from this, talking about research culture, about the CQC, and we've hopefully got some extra special guests. I'm not going to give it away yet, but it'll be really exciting if we manage to get those guests to come and talk. There's a QR code here if anybody has any feedback about our webinar today, and please feel free to be sending the registration form and all of the contacts and the YouTube channel and different things, the toolkit, everything to your colleagues, to help create that research culture, and hopefully the toolkit can help support this topic on ward accreditation, because there's loads of practical tools in there that might just help stimulate. Actually, that might be the question for us, you know, that we can add into our organisation. So thank you so much. That was really, really excellent again. And yes, thank you to all our speakers and everybody for attending. And we will see you. We'll have a break for summer, and we'll see you in September. And have a good rest of your day. And hopefully it doesn't rain too much and the sun comes out.
Thank you. Thank you. Bye.
Thank
Bye.
you. Bye.
Thanks. Bye.
Bye.
Thanks a lot. Bye bye.
Thank you.
Thanks, everyone.